This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Welcome, everyone, to today's episode. I'm Roy Strowd, neurologist, educator, neuro-oncologist at Wake Forest University, and delighted to be here to talk about non-traditional educational formats and how they're reshaping neurology training. I'm here with three rock stars in neurology education, heavy hitters, Jeff Ratliff, Tesha Monteith, Justin Abbatemarco, and excited to talk about this topic with them. But before we dive in, would love for each of you to introduce yourselves, just briefly sharing your name, institution, your primary role in neurology education, and what draws you to exploring these new and innovative learning methods. Jeff, do you want to start and introduce yourself to the group?
Yeah, happy to say hello and introduce myself. Podcast listeners have heard me before, but I'm Jeff Ratliff. I'm at Thomas Jefferson University in Philadelphia. And primarily, I'm in the resident education space. I'm the residency program director here. And in terms of innovation and exploring this, it's really fun to be creative in thinking about how we teach residents, how we teach learners, and also residents as a group of learners are great at giving honest feedback on what they want and how they like to learn. It's a great group to work with in that role and to think creatively along with them.
Nothing like some honest feedback. We are with you. We get that. Jeff, great to have you with us. Tesha.
Hi, I am Tesha Monteith at the University of Miami. I'm a professor of clinical neurology. I am the fellowship director of headache medicine. And as a faculty member, I engage with residents as well as medical students, in addition to, of course, our fellows. And the podcast is just a nice way to supplement all the learning that we do. And it's very interactive and engaging. Sometimes fellows will listen in on a hot topic when we have our headache medicine series, and they hear me talking with high-level experts. And so this is just something you may not be able to get in a traditional curriculum.
Yeah, great point. We're learning all the time. And that's really that non-traditional piece. How are they helping us with that? Justin, do you want to round us off?
Thanks for having me. I work at the Cleveland Clinic core faculty part of our residency and do a lot of fellow education. And for me, this message really speaks like the challenges that we face. And how do we tackle this? How do we teach the next generation? And I love hearing from others.
Yeah, there's no better role than putting the podcasters on the hot seat. So this is what we're doing today. We've got a number of questions. Today, we're talking about a topic that is rapidly reshaping how we train the next generation of neurologists, the rise of unconventional alternative learning tools, podcasts, AI, tech-enhanced learning, while foundational approaches like bedside teaching and traditional didactics are really the essential and the core parts of our training and learning. There's new ways out there, and our residents, our students are seeking flexible, accessible, often digital formats that meet them where they are. Podcasts, tutorials, now even AI-driven platforms are no longer peripheral supplements or things you do on the weekend. These are integral parts of learning all throughout the neurology training experience. They've become core components of modern learners and how they engage with neurology, build clinical reasoning skills, understand teamwork, and stay connected to emerging science. So our conversation today will explore how these tools are changing the educational landscape, how we can use them responsibly and effectively as educators, and how programs can integrate them alongside the traditional bedside learning and didactic learning to support diverse learner needs. And we're going to dive into all the details, some of the science and a lot of the experience with these tools. So let's get started. The first question we'll put to each of you. Let's hear how everyone's doing this. Over the past several years, what changes have you noticed in learner behavior or expectations? How has this opened the door for more unconventional learning tools? What are you seeing out there? Jeff, do you want to start?
You've touched on a lot of these things. I'll hit a highlight and maybe a caution that I've learned. And I'll say that, as you said, the access to information at our fingertips, the digital access, I think we all agree is the biggest change. The pattern towards literally in the palm of your hand learning that students, residents, fellows, even all of us in practice are doing. And that's residents walking around doing question banks to practice spaced repetition learning and looking stuff up, whether that's with AI-driven open evidence type platforms, but just the on-demand, just in time, I need to know a piece of knowledge now, and I can whip out my smartphone mobile device, and there it is. That is still changing, will continue to change. I'll say the caution of anecdotes of, in addition to teaching the residents, I do teach medical students here at our medical school. And when they're giving presentations, I will still find if they say something, they give a fact, and I'll turn to them and say, oh, tell me where you found that, or where did this info come from? And I get a lot of, that's what, insert your large language model, ChatGPT, Claude, or whatever. That's what that said. And I, as someone who's had some experience, will identify that's not quite right, or it's overgeneralized. There's still a need for the expertise of the teacher, or to think about where does the pattern recognition mechanism of a large language model that's giving information, it still can hallucinate, it still can generate false info, and that we need to be vigilant to keep an eye out for where those tools are not going to meet their mission. So I think those are two things I would share.
Great tips. I was literally just seeing a patient and open evidence to a question that we have. So it's just always at our fingertips. And that concept of cautious skepticism, like that is a behavior we should be teaching as we're using these. Tesha, what's your sense? What are you seeing out there? How are you seeing learners using these things? What are you seeing?
I see a hunger for more asynchronous learning. The lectures are always something that bring us together. We are able to see each other's faces and connect. But when we're not together, people on their own time, some people are morning learners, some people are midnight learners, and they want to be able to listen to what they find either interesting or they find a need for. So it's no longer this cookie cutter A to Z. I mean, sadly, some people don't even have textbooks anymore. I have issues with that. But the point is that having access to these more innovative tools allows for more personalized learning, which in some ways supports diversity of thought, right? And style. And so that is something I'm seeing. And of course, the pandemic had something to do with that. But even before the pandemic, as we've mentioned, the attention spans are so limited these days. And so we need different modes of learning.
Yeah, great point. The personalization, right? Not everyone learns in the same way, at the same pace, at the same rate. So these are tools. I love that. Just highlight technology is a tool. It's not the answer. How you use it is almost as important as what you use. Great point. Justin, what are you seeing?
Yeah, I'm seeing those same trends. And maybe to try to touch on something different, maybe those quick tidbits, that TikTok style learning, which has really challenged me. It's definitely not been my approach when I was growing up, but to try to reach this next generation, I send them a PDF with 20 pages. I'm just not sure how many people are reading that. And so trying to reach learners in this generation that are looking for those quicker tidbits, and maybe using Jeff's model here, maybe a caution there when we're trying to talk to them and during rounds, and how we avoid that superficial learning with that type of style is something that I think about on rounds or when we talk about patient management. But these other points about asynchronous learning, learning on demand, these question banks, those are also themes that we definitely see across all learners at this stage.
Yeah, it seems we're hitting on a theme here of how can technology be a gateway into learning more and not a superficial approach to take learning less or really diving into the depths of things. And that's a good call out, both of those cautions. Let's turn to some of these technologies and maybe start with podcasts. This team knows all about podcasts, but Jeff, what role do you see podcasts playing in neurology training today? And what makes them such effective tools for learners?
When we think about podcasts, we've used that word asynchronous, where people can access learning, access information when they want it. And the podcast certainly gives a lot of flexibility to do that, where listen to this when it works for you, whether it's at midnight, like Tesha said, or just before you go see a patient or whatever it may be. The other advantage and benefit of the podcast, although I'll talk a little bit about how it can be a pitfall too, is the podcast being purely auditory can be done in so many different settings, right? You can be driving in the car, you can be working out, cooking dinner, you can just be sitting and listening. There's so many different environments where we all just have earbuds, we pop in our ear, and you can be consuming a podcast in the background. That's the double-edged sword, though, of podcasting, where you can be in an environment doing something and this knowledge and is being shared with you, a conversation, a monologue about a topic, and that's well and good. But we have to keep in mind that paying attention is part of learning. And if you're engrossed in some other task, as much as we would love to just download knowledge into our brain or it gets there through osmosis, you have to be proactive and active and engage with it, whether that's taking notes, rewinding, going back and listening to what Justin said about the autoimmune entity that he's teaching about in that episode. But you do have to be a little engaged. That's a little bit of the caution that if it's just background noise, how much of that knowledge is going to stick? We just have to be mindful of that when we're talking about podcasts.
Bummer. I can't turn on the podcast and go to bed and just know everything in the morning for my patients. So it's a great point that we tend to be hitting again and again. And this is a tool for learning. It isn't learning downloaded. And how do you use it? Tesha, Justin, any other thoughts that are in your mind on podcast, or how do you use these things? Yeah, Tesha, what do you think?
Yeah, I love what our residents do because they integrate the podcast as part of their weekly curriculum updates. And so they have the schedule with the didactics and the half-day learning, and then they'll add some links to the podcasts that integrate with whatever the theme is. And I think that is just so awesome. And for the people that can't go there post-call or whatever the case may be, they still have some resources, including interactive resources that they can learn from. It's a complement to a structured residency education or fellowship education.
Great point is how can some of these tools, non-traditional methods, not replace the typical ways that we have learned, but supplement? That's just such an important word. Justin, maybe we turn to something different. Social media is increasingly common and it's become a major educational space. There's tutorials and TikTok and Instagram reels. My kids come home and they're talking about social media. I don't even know about at this point that they're using and things. And these short form posts are really being used for micro teaching increasingly. How do you see social media contributing to neurology education today?
Yeah, the future is already here, right? This is a part of the resident medical students' curriculum already. And so acknowledging that. The news does a lot about talking about the negatives around social media. We're aware of those. But talking with some of the students and trying to understand like some of the positives, words that I heard, and they apply to the podcast as well, but they have this ability to create a community that is difficult to do when you read a textbook or when you read an article. They're able to maybe connect or hear about a message that was in the article, but hearing directly from that expert in whatever disease, headache, neuromuscular movement, that can maybe make that connection much more real for them. They can relate to students and questions, and this ability to interface in a totally different way is really powerful. And maybe community on other areas as well. I heard students talking about how they've adjusted to the sleep-wake cycle of like night shift, how they go through the interview season. I don't know, hearing about real world challenges and hearing how they use social media to, again, connect with other learners or connect with experts in the field, I thought was really powerful. And so trying not to look at so much of the downfalls. We've talked about the superficial nature of these, how you know where those sources are, but there are some ways to really turn it into a positive and allow it to be a way to supplement education outside of the four walls of a classroom.
Justin, that's such a good point. I didn't really think about that social aspect of learning. And it is such a social process. And social media, it's the social part, right? There's that piece that can help link and hinge in the same way a patient often does. They link the learning to the patient, but that dialogue or discussion is a good thing. Is there anything about social media that you see in terms of visualization? Tesha, Jeff, how do you see that with social media? Is that a helpful piece of that tool to learn? Does it get in the way? Tesha, what do you think about that?
Yeah, I think that it's nice because it's like we talked about this micro learning and even like back to the tutorials, that when you have this interactive component, and there's been great examples of that with imaging, sometimes biopsies that you can show and adding polls to that, and just to have that multimedia experience, that is very powerful for learning and engagement.
Yeah, that's a good point. Not everything on social media is going to teach you something, but there's a way to teach really effectively through social media, seems to be what we're saying there. And actually just learning what content trust and content distrust can be a helpful part of the learning method. Let's shift gears a little bit and maybe spend some time talking about AI platforms. This is just there. It is all the conversation. This is, I don't even know if emerging quickly is really accurate to say. It's here. Jeff, maybe if you want to start with this one, what excites you the most about the potential for AI in neurology education? And what concerns should educators keep in mind as we consider these as they evolve?
So we've talked a lot already about learning and teaching as a way of acquiring knowledge, right? We're picking up facts. We want to learn about this disease. We want to learn about different aspects of what we do in neurology or as physicians. My personal sort of favorite cool thing that these AI models can do is it's all of a sudden you can simulate that back and forth. And so now, not in the palm of your hand, you're not just learning about the checklist of diagnostic criteria for one thing or looking up imaging findings, but now AI can simulate a patient interaction, right? We could train an AI model to simulate giving the history of a patient with migraine or other headache disorder that Tesha could share with her learners, and they learn about what questions do I need to ask to figure out, is this migraine or is this a sort of autonomic cephalgia? How do I distinguish that? So that back and forth and that literally in the palm of your hand simulation type of model is really cool and opens up a different type of learning that we don't get with these other platforms that we've been talking about.
Tesha, what are you seeing? Are you seeing AI used? How is this happening in your space?
Yeah, I agree with some of the simulation. I was involved in some global education in Kenya, and we had to create case-based learning and some things that, like, to be honest, I've never seen someone with malaria presenting with headache. And so I had somehow be smarter than the people I was teaching. And so I used the AI to help build up the cases and to make it very convincing, even to create some of the images where I didn't have to use a stock image to make it very engaging. Case-based simulation is one way to do it. I've used AI to analyze my curriculum and look for gaps and ways I could fill it in. And so that has been helpful. And another way I've used AI, honestly, is to help me create a feedback for professional development, especially at times when some of the feedback is a little bit difficult, didn't know quite words to use to provide that feedback. And sometimes your feedback style can actually be analyzed, and there are AI programs I haven't used yet, but actually help you analyze your feedback. And so it's really a 360 benefit of AI. Obviously, it needs to be monitored because there's a lot of opportunity for mess ups. And I have to also say that.
That's just such a good point. Is just going to take it hook, line, and sinker. Can we trust it? Are there going to be hallucinations? But you have both brought up the ability of this technology to present data. And the learning is actually the critical evaluation of what you're being presented. You're really able to engage in it, which we know is a highly effective learning strategy. And this is a neat tool to do that. What type of educator oversight do we need to have with this? Often our learners are out there testing these platforms as much as we are. What do you see as the role of the educator in that process? Any things that our listeners should take away about that?
It's important to know the resource. Where is AI pulling this information? Where are they learning this? And you can watch it search. And sometimes if you watch it search, it's like searching lay articles that are not coming from academic sources. So you want to ask what the references are. You want to look up those references to see whether that is really something that is true. And so while it's very powerful, you do have to be careful. And just like anything else, check the references.
Well, before we close, I've put you on the hot seat long enough, so maybe we do role reversal. And I'd love to flip the format a bit. You've each shared some incredible insights today, and I'd love to hear what questions you might have for me. Is there something on your mind about neurology education or about where these unconventional tools are headed that you want to ask from your perspective?
I want to ask you, as an editor, what articles are you looking for in this innovation space? I know you're not saying that you're going to accept it, but what things are you looking for in the journal?
Yeah, this is a great question. Journal's looking for everything. So submit what you're doing is one way we think about it. But this is a good question. We talk about these tools a lot and we're excited about their potential. The papers, the articles that really excite our readers the most are those that dive into how can these tools be used to change outcomes. We're really talking about teaching tools like the reflex hammer, like the master clinician at the bedside. And we want to understand how should these tools be used? In what ways can they be used to promote learning? And when they are used, what happens and how does that learning occur? So those are the papers that the journal is really excited to receive. Our reviewers are always really excited to review those. Is not look at this fancy AI tool or LLM or podcast, but I have this tool and I have a problem with the learner group I'm working with. This is how I integrated that tool, that podcast or the open evidence or the social media learning. And this is how the learners engaged with it and what happened when they learned. And that's really exciting for educators to read about because they may have access to that platform and that tool. They may not. But it gets them thinking about how can I use these types of non-traditional tools to get that same type of learning from the students, residents, fellows, or even faculty or APPs or others that they're working with. So those outcome-driven explorations that tell us how and why a new technology tool works are really exciting.
Right. I love that idea of its practical approach to these articles. For residents or even faculty, when they're thinking about educational outcomes, could you give some more concrete examples of how they could approach those? Because it could be really challenging to implement into practice.
When we're thinking about a new curriculum, one of the models that we tend to draw from is Kirkpatrick's model for curriculum evaluation, which is a 4-step approach to evaluating a new curriculum or a new teaching tool. The bottom level are learner reactions, which I'm actually going to come back to. That's one of the most important things to think about and assess. Then we think about assessing knowledge or skills that were generated as a result of that tool, behaviors that were changed, and then end results that were influenced by this. I actually think that level 1, like learner reactions, is one of the most important things to think about with a new technology tool. Because it's not just satisfaction. Were the learners satisfied or would they recommend it? I'd love to know, how did they use the tool? When did they use the tool? How long did they use it? If we're talking about podcasts, were they working out or how did they integrate it into those things? Really getting nuanced into that, even level 1 can be a very helpful way of evaluating a new technology tool. You got to evaluate knowledge and skill generation. Behaviors are really neat to look at. If we're doing just-in-time learning, are you able to implement that knowledge just in time for the patient in front of you? It's right there. And so thinking about some of the ways technology can influence behavior change, that does start to excite educators and program directors and those people. Or outcomes to think about when you're designing this type of study or even just implementing a new tool.
It's so helpful. It makes it so much more accessible because it can feel a little overwhelming at first, but I really like those points around just even some initial reactions to help understand these things.
I think about what Apple did when they first developed the iPhone. They gave a bunch of people an iPhone and just watched what they did and then wrote it down. And that's actually something we could do with a lot of these tools as educators. It doesn't have to be a super sophisticated study design. We want to see the tool, implement the tool, and then kind of watch. And the key is the structured approach to taking those notes and evaluating that process. In terms of validity, we call that response process validity. What happens when you implement often an assessment tool, but we could think about technology tools in the same way. How does it change the learning environment? And can we dissect that and understand that? And we're always doing that as educators. In person, we're feeling out the room and watching the educators. And in an education research study, there's the same way of quantifying that or qualifying that can be really attractive for evaluating a new tool. All right, I want to thank each of you for such a thoughtful and energizing discussion. I'm going to pull my phone out and do some stuff after this and see what I can learn. It's clear that the future of neurology education is really already being shaped by new tools, as well as creativity and the attention behind how we use them. I'm grateful for the work you're doing and the ways we're all pushing the envelope here to think differently about how we can teach and learn. Doesn't mean we're giving up good bedside neurology instruction, but supplementing that in a way that's really engaging. Thanks to everyone for listening. We hope this conversation sparks new ideas in your own programs and your classrooms.
Thank you.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.